Good day, everyone. We are presenting Critical Care Cardiovascular Nursing, Road to APN Cardiology Nursing Specialization, in partial fulfillment of the requirements for AAN 205B, Cardiovascular Nursing. Our group, composed of Moammar Hilay, Shiela Mae Bugahod, Emamuel Galecia, Rosemarie Gumatay, and Dara Cosare. Today, we will take you through the critical role of nurses in managing life-threatening cardiovascular conditions, the journey toward specialization, and the emerging impact of advanced practice nurses in shaping the future of cardiovascular care. Because in this field, every second matters, and every decision can save a life. Cardiovascular Critical Care Nursing. Cardiovascular critical care nursing is a specialized area of practice focused on the rapid assessment, stabilization, and management of patients with life-threatening conditions. It primarily involves the care of critically ill individuals with acute cardiovascular emergencies. This role requires advanced clinical competence, timely decision-making, and the ability to function effectively in high-acuity environments. In this context, prompt and appropriate interventions are essential to improving patient outcomes. Patient population. Behind every critical case is a patient already carrying a heavy burden. In critical care cardiovascular nursing, we primarily care for adult patients, many living with hypertension, diabetes, and coronary artery disease. These are not just conditions, they are silent risks that can suddenly become life-threatening emergencies. And this is where nurses step in, recognizing vulnerability early, understanding complex patient profiles, and acting before it's too late. Because in this field, knowing your patient is not just important, it is life-saving. Common critical conditions. In critical care, we encounter some of the most urgent and life-threatening conditions in medicine: acute coronary syndrome, cardiogenic shock, severe heart failure, and lethal dysrhythmias. These are not just diagnoses, they are moments where time is limited, and every action matters. Patients who have survived cardiac arrest, for example, remain extremely fragile. And in these situations, nurses are not just caregivers. We are decision makers, responders, and lifesavers in real time. Clinical settings. This level of care happens in highly specialized environments, the ICU, CCU, CVICU, and CICU, where technology and human expertise work together. Here, patients are continuously monitored, supported by advanced life-saving equipment. But even with the most advanced machines, it is still the nurse who interprets changes, recognizes danger, and acts immediately. Because in these high acuity settings, technology supports care, but nurses drive survival. Nursing responsibilities. At the heart of critical care is the nurse's responsibility. Continuous monitoring, rapid clinical judgment, and early recognition of deterioration are not optional, they are expected. Nurses must identify dysrhythmias within seconds, support resuscitation efforts, and anticipate complications before they occur. This role demands more than knowledge. It demands vigilance, confidence, and the ability to stay calm under pressure. Because in critical care, hesitation can cost lives. Education pathway. The journey to becoming a critical care cardiovascular nurse begins with a strong foundation: a Bachelor of Science in Nursing, professional licensure, and real-world bedside experience. These are not just requirements, they are the building blocks of competence. Every shift, every patient encounter prepares the nurse for more complex and high-stakes situations. Because excellence in critical care is not instant, it is built through experience, dedication, and continuous learning. Certifications. To function effectively in emergencies, nurses must be equipped with essential certifications such as BLS and ACLS. These are not just credentials, they are life-saving skills. The ability to interpret ECGs accurately can mean the difference between early intervention and missed deterioration. In critical care, preparation is everything. Because when a crisis happens, there is no time to hesitate, only time to act. Advanced certifications. As nurses grow in this field, specialty certifications like PCCN, CCRN, and CMC become markers of true expertise. These certifications reflect not only knowledge, but commitment to excellence in patient care. They signify readiness to handle the most complex cases with confidence and competence. Because in critical care, expertise is not optional. It is essential for delivering safe and high-quality care. Clinical exposure areas. Clinical competence is developed through exposure to high-acuity environments. ICU, emergency departments, cath lab recovery, and post-cardiac surgery units. Each area presents unique challenges and learning opportunities. These experiences shape the nurse's ability to respond effectively in critical situations, because the more exposure we gain, the more prepared we become to face the unexpected. Clinical progression. Becoming an expert in critical care is a journey. It often begins in telemetry or step-down units, where foundational skills are developed. This is followed by intensive training in ICU or CCU settings, where nurses manage complex, unstable patients. Over time, exposure to specialized areas like CVICU and mechanical support further enhances competence. Because mastery in critical care is not rushed, it is earned through time, experience, and continuous growth. APN role overview. The role of the advanced practice nurse is evolving in the Philippines, guided by legislative efforts such as House Bill 9389 and Senate Bill 1447. These frameworks aim to expand nursing practice to meet healthcare demands. APNs are positioned to provide advanced clinical care, bridging gaps in the system, and improving patient outcomes. This is not just a role expansion, it is a transformation of nursing practice. APN scope of practice. The scope of the APN role varies between proposed models. House Bill 9389 supports a more expanded role, including diagnosis, prescribing, and ordering diagnostics. Meanwhile, Senate Bill 1447 emphasizes a collaborative, physician-guided approach. Despite these differences, both highlight one key message: the need to elevate nursing practice to better serve patients, because healthcare is evolving, and nursing must evolve with it. APN clinical role. In critical care, APNs take on advanced responsibilities, conducting comprehensive cardiovascular assessments, interpreting ECGs, managing hemodynamics, and overseeing complex devices like pacemakers and defibrillators. They also lead during emergencies, where rapid and accurate decisions are crucial. This level of practice represents the highest form of clinical nursing, where expertise directly impacts survival. Justification. In cardiovascular critical care, many conditions are described as minutes to outcome events. Delays in recognition or intervention can lead to irreversible damage or even death. As care becomes more complex, the need for highly skilled professionals becomes more urgent. APNs help meet this need by providing advanced decision-making, improving response time, and strengthening patient outcomes. Because in these moments, expertise saves lives. Impact in closing. The integration of advanced practice nurses in critical care leads to better patient safety, fewer complications, and more coordinated care. It strengthens healthcare systems and ensures that patients receive the right care at the right time. Ultimately, this is about improving lives, not just treating illness. Final closing. In critical care cardiovascular nursing, every second and every decision can mean the difference between life and death. Through advanced practice roles, nurses are not only saving lives, but shaping the future of healthcare. Before we conclude, we would like to express our sincere gratitude for your time and attention in watching our presentation. Critical care cardiovascular nursing is not just a specialty. It is a responsibility to respond, to act, and to care in the most critical moments of a patient's life. We hope this presentation has inspired a deeper appreciation of the vital role nurses play in advancing patient care and improving outcomes. Because in critical care, every second counts, and every nurse makes a difference. Once again, thank you very much, and have a wonderful day.